Hey everyone, Dr. Mike Stacey, chiropractor, Masters of Science in Exercise Physiology here. This is day 2 of our low back pain, strengthening your spine series. And so what we did yesterday is we did kind of this relaxation exercise where we put our legs up here and laid on our back. Again, for a lot of people that has almost instantaneous relief. One thing that I want to address that maybe if you were feeling yesterday is when we are experiencing our pain, if any of these motions bring about the pain that we're feeling, if that feeling of pain is up here, we want to do everything exercise until we get to about here. We don't want to do anything that causes the pain to come back or go above and cause more pain. Pain is just your body's way of saying it doesn't feel safe and it needs you to stop. And so if we see it as a positive thing and as a signal instead of a negative thing, we're not trying to get rid of the pain. We're just trying to make sure that we're doing things within a range that is tolerable for our body. So don't push through the pain. Don't do anything that makes it worse. Of course, if anything gets worse, please see your doctor or other qualified health professional. So second exercise we're doing. So first one we're going to do is we're going to do that same chair breathing exercise that we did yesterday. So do that before this one I'm going to show you. But the next exercise, exercise number 2, is while we're here, okay, we were doing the breathing and we were doing the expansion of the core and kind of the stabilizing of the core in here. The next thing we're going to do is we're going to go through those breathing exercises again, but this time what we're going to do is we're going to visualize our pain. We're going to kind of picture it in our minds, okay? And when we see that pain, we're going to imagine, I've got my eyes closed here because it helps me with kind of explaining. We're going to see that pain in our mind. So if the pain is, in this part of our low back, and now it's kind of relaxed a bit, we're going to see that pain in our mind, and we're going to imagine that that pain is like a light bulb. Okay, so we're going to breathe in, and as we breathe in, we're going to see that pain as a light bulb getting brighter. Okay, so if my hand is a dim light bulb, then when we breathe in, it's going to get brighter, and we're going to visualize that pain that we're feeling being that light bulb. Okay, so we're just going to breathe in. Okay, and so on the exhale, while we're still keeping our core nice and stabilized, okay, not squeezing it, but just keeping it solid down here, when we've made the light bulb bright, what we're also going to do while we're breathing out is then we're going to imagine the pain, which is the light bulb, getting dimmer as we breathe out. Okay, so while we're breathing in, we're imagining the pain as a light bulb getting brighter, and then when we're breathing out, we're taking that light bulb and making it dimmer. Okay, so just breathe in. And again. All right, so a quick explanation of what is going on is the pain centers in our brain that kind of perceive the pain. If we don't attach some sort of visualization or picture to that pain, our brain is going to create a certain, I'll call it, narrative around what that pain is. However, our brain is super powerful, and so if we can associate the pain with something that we're in control of in our mind, so like taking a light bulb and making it brighter, and then we're in control of making it dimmer again, and we're associating that with our breathing during a targeted exercise, what that's actually going to do is while those muscles that we're stabilizing in the core are activating properly, now we're actually taking control of the pain that's maybe associated with those muscles firing or not firing, and we are attaching it to some sort of visualization object, and that's going to make it so that our brain feels like it's in control of the pain, and it can almost turn it on and off at will, okay? So what you're going to do is you're going to do that chair exercise just like we did yesterday. Do it 5 to 10 times, 2 breaths per set. Remember, just expanding and opening the core on a breathe in, and then stabilizing it while we breathe out. You're not compressing, you're just keeping that shape that we've opened up while you're breathing out, okay? Then you're going to do this visualization exercise while you're breathing in and out. Do that 5 to 10 times. This is 1, 2, 3, right? If you want to associate it with your fist too, that's okay. I find it helpful, but if you just sit there and you just imagine the light bulb getting brighter and then dimming again, and that light bulb is the pain that you're feeling, if it's in a certain spot or if it's just all over your low back. That's your exercise for today. Again, super simple. This shouldn't take more than 10 minutes out of your day. But what we're doing is we're setting that good foundation for proper activation of the little muscles in our back, and we're getting control of our pain. So hope this helps. In day 2, in the next video, we'll be building on these exercises and doing something a little different. Thanks.